Sam Bulavinaka, and a warm welcome to Speak Your Mind on Gold FM. It's lovely to be back with you again. And I must say a big thank you to Dion Dhavu for being here while I was enjoying my holidays away. Now, thank you again, Dion. On the program today, we'll discuss in depth the illness tuberculosis. Now, our guest in the studio is Dr. Kama, who is from the Ministry of Health, and this is at the Tumi Hospital in Tamavua. Welcome to Speak Your Mind, Dr. Kama.
Thank you, and Bulavinaka Louise and your listeners, very pleased to be here.
Oh, it's great to have you as well. Well, my first question is, what exactly is TB?
Thank you, Louise. So TB technically is basically the mycobacterium, the causative agent for tuberculosis. Tuberculosis is the disease. So generally, people refer to TB as basically the disease itself as well. And basically, tuberculosis imposes important or significant public health issue in Fiji for several years now, for almost 6 decades, and it's still around. And basically, the symptoms and signs of tuberculosis is basically, cough, weight loss, maybe more than 2 weeks of cough. There's weight loss. There's also the general feeling of being unwell. Those are the characteristic symptoms, including fever. So that when someone has those kind of symptoms, we generally and usually ask them to present to the nearest health facility.
Okay.
So that they can be diagnosed and then treated after that if they've got the disease itself.
Okay, so could it be a challenge sometimes for people to realize that they have tuberculosis? Because, you've mentioned fever, cough. Sometimes you might not even think that you have it. But like you said, coughing for 2 weeks?
Yes, absolutely. Thank you, Louise. The symptoms are, as you mentioned, generally non-specific. Some of it is non-specific. Most of it is. They call it constitutional symptoms in the medical arena.
Mm-hmm.
But otherwise, if someone has more than 2 weeks, coughing for more than 2 weeks, so basically the suspicion is very high that it may be TB, and the recommendation or the advice is to seek diagnosis or something like that from the nearest health facility.
Right. I think it would be safe just to do it. Even though if you may not have tuberculosis, but you have those symptoms, it would be just good to go and see a doctor. And that would be at the Tumi Hospital. Is that where you do the diagnosis?
Yes, there are several facilities. Previously, in the early years of the program, of the National TB Control Program, it was localized or centralized to the Tumi Hospital, where the TB outpatient and inpatient facility is. Over the years, there's been some decentralization. So they've got what you call DOT centers, directly observed treatment centers.
So where would these centers be?
Yeah, so they are at in the north as well, in Lambasa, so Lambasa Hospital, and also in the west. In Lautoka Hospital. So these are the 3 DOT centers that are there.
Mm-hmm.
We have treatment centers as well. So those are basically diagnostic and treatment centers. The other treatment center that we also have around the countries in the north, in Rambi. So it has a treatment center as well. But there are also diagnostic facilities. There's about 10 of it around the country. 10
That's
diagnostic
great.
facilities.
Yeah. So how does a person catch TB?
The transmission of tuberculosis, basically, it transmits from someone who has the disease through the air. So it's air droplets, airborne.
It's an airborne bacteria.
Yeah, so when they cough or they sneeze, it's transmitted to someone that doesn't have the disease.
Mm-hmm.
So they inhale this droplet nuclei, as they call it.
Oh.
So basically, when you're just talking normally and someone is within, your
Short distance, yes.
So there's about almost 200 of these droplet nuclei that are suspended in air, and then when there's moving air, it flows away. So the transmission is probably not there. But then when you cough, there's about 350 of this, 3,500 of these droplet nuclei. And then when you sneeze, it's even more. It's almost 4,500, 5,000, So if someone has those infected droplet nuclei, so the risks are greater if you cough or if you sneeze in an area that is not well ventilated because it hangs out there and people
Okay.
can actually breathe this in.
I mean, you'd have to be really unlucky to be breathing in this bacteria because, I mean, you don't know where it is. Like you said, if there's poor ventilation, that
Yes.
would increase the chance of getting this airborne bacteria.
Yes, absolutely. So there's this concept about the air exchange rate. So basically, there has to be a certain amount of exchange of air. And so that if you have good ventilation, you'd want to
Right.
see that the air continues to move within 6 to 12 hours. There's a complete replacement of air. So that
Okay.
if you have windows and maybe some mechanical, fans or something that can move this air, it's important to have that.
Right.
So in communities that have lots or little room, plenty people, and very little ventilation, these are high risk areas that can,
See, little.
you just need to put someone in there with TB and it's going to be an issue.
Oh dear. Yeah, that's pretty dangerous. So, how is it spread again? I mean, you've mentioned, of course, the coughing bit, and sneezing
Yes,
with someone who is actually carrying it.
yes,
Okay, so is there any other way?
yes, absolutely. So there's also it can be ingested as well. So there's this this transmission mode of drinking unpasteurized milk, especially through this is bovine TB, they
Okay.
call it. So that, but nowadays this is not so much a risk, and we see very little cases of bovine TB because most of our milk is pasteurized. But then again, that small percentage has been increasing, although it continues to be small. That percentage of cases of bovine TB, it continues to increase among the human population. And then when you have, an outbreak of bovine TB among cattle
Yes, that's what I was
currently,
going to ask you. Yes.
yeah. So the risks are quite high at the moment. If you're not drinking pasteurized milk, you're drinking raw milk.
Like the ones that they deliver fresh in the
Yes, that's
buckets.
that's the ones that are, yeah. So that chain, we need to really ensure that there's quality pasteurization that's there. Otherwise, this is going to be an issue
Okay.
in the coming years.
So if you do get fresh milk, what do you have to do so that you decrease your chance of getting TB?
It's important to
Just
boil
boil,
it.
just boil it. For how
Very, very
long?
simple. Well, at least it has it boils.
Okay, it gets to boiling
Yes,
temperature.
boiling temperature.
Okay.
That's the first thing, and then if you put it there, leave it to boil for about a minute, even 5.
Even
Yeah,
better.
it's even better.
Oh, okay. So has anyone, well, anyway, we've just come to the end of this first segment on Speak Your Mind, Gold FM, only the classic hits. We'll be back soon for more. Welcome back to Speak Your Mind on Gold FM, only the classic hits. And today we have Dr. Kama from the Ministry of Health. He's based at the Tumi Hospital in Tamavua, and he's talking about tuberculosis, which I find very interesting. But I think we've got a caller on the line. Oh, no, we don't. But yes. Anyway, where we left off, I mean, the important points where you said the other ways where you can catch TB is with the milk, fresh milk getting delivered to places, and if you don't boil it, that's another way of catching TB. So you've already told us that we need to boil the milk. I mean, at least for 1 to 5 minutes would be really good to keep safe. So is there another way that a person can catch TB besides the fresh milk?
Generally, I think those are the two main ways, but it's more on the pulmonary transmission through airborne droplet nuclei.
Okay.
I think that one also almost takes up more than 90% of the transmissions in Fiji.
Oh.
Yes.
I mean, that was a really good point that you said that ventilation, it's so important. I mean, you need to be circulating the air, especially if you've got plenty of people in a room and someone who has TB there, it's going to be a real issue. Well, thank you for sharing that with us. So what are the basic hygiene rules of keeping TB contained, Dr. Kama?
Generally, we advise the general public and also patients that come to the hospital on good cough etiquette because we find that most of the transmission occurs due to coughing, because there's a lot of coughing
Yeah,
in the disease.
unfortunately in Fiji we're terrible. I see people
Yes,
coughing and spitting all over the place.
absolutely. So that's a major concern
Mm,
with the transmission. So
okay,
sneezing, not so much, but coughing is something that happens quite regularly with this disease.
okay.
Yeah. So what we intend to do in our first steps of treatment is to bring the cough down.
I
So
see.
that there's very little coughing that happens.
Okay.
So basically that is key.
Okay, thank you very much. And I believe there are two main types of TB. Can you explain more?
Okay. Yes, Louise. So sorry, I didn't quite finish. In terms of the hygiene. So
All right.
so
Oh,
so
I'm
with
sorry. Yes.
coughing,
Okay.
then
Mhm.
there's also the general hygiene, and basically that's washing your hands. It's important to
Oh,
wash your hands as
very
well.
important.
Yes. And then sunning out your beddings. So these are important as well, because you kill the bugs that way as well. And once you cough it out, the bugs can be still alive.
Mhm.
Can be still alive. So you in your bed sheets or whatever you use,
Yes.
so you sun it out so that they can actually die.
So that's a good habit because my children think I'm crazy because I'm always sunning out my blankets and pillows. They say, "Oh, we already did it yesterday, and you want to go and do it again today?" And every second day I like to do that. So I'm glad that I'm doing that.
Yes, absolutely. So
Mm.
that's part of the hygiene. That's part of infection control as well. So if you're sunning things out, that can be the underlying rationale. Yes, you're trying to kill whatever's there.
Right.
But in terms of the question that you posed earlier, and this is about the kinds of TB. So you have the pulmonary TB that I had just discussed. So it's transmitted through air,
Mm-hmm.
and the bugs tend to sit in the lungs, on the higher uh,
The
upper
respiratory,
area,
yeah?
the upper areas of the lungs.
Okay.
So they sit there, they do their pathology or pathological responses there, and the other one is extrapulmonary TB. So these ones here, usually, so it can be transmitted from the pulmonary into the blood. So it can infect the blood, and
Mm-hmm.
then it moves to other organs outside of the lungs. Or
Oh.
things like, the bovine TB, where you drink milk and then it affects all the other parts of the body outside of the lungs. Yeah, so expulmonary is outside of the lungs.
Mm.
And the main areas in terms of extrapulmonary TB that it affects is the brain. So you get TB meningitis in our setting.
Oh, that sounds awful.
That can be very awful, and it can also lead to death at
Mm.
most times. There's also, they call it the scolula, and that's in the lymph nodes, especially around the shoulders, and so the lymph nodes, and also there's pleurisy around the lungs and the covering of the lungs. Yeah, so these are very bad illnesses that one can get, the extrapulmonary, and at most times they are very complicated, very difficult to treat, and it has a very high risk of death as well.
That
Yes.
must be a real challenge. But just moving on, how does this bacteria that causes TB live in the environment? Oh, you already told me the air.
Yes.
So they're just alive, floating around in the air?
Not exactly. It's with the person.
Oh, I see.
Yeah. So once it finds its grounding in a population, then it's transmitted from person to person. The really peculiar thing about this disease is that it can also be dormant in the body. So it goes into the lung and it's dormant there. It sleeps there.
Oh.
It doesn't affect the person for quite a while, and this is called latent TB infection.
So it doesn't affect them
It
for a
doesn't affect
while.
them, yes,
So like maybe how long?
years,
Yeah.
many years, until and unless your immune system drops. When your immune system drops, then it gets activated.
It's amazing
Yes.
because I always find it interesting about how important the immune system is.
Absolutely.
And maybe you might like to explain simply why the immune system is good and why we need to keep it good.
Yes, absolutely, Louis. So basically, the immune system, this is our defense mechanism. Every day we go out there into the environment, or we wake up, we are swimming in a sea of microbes, pathogens,
Right.
and it's this defense mechanism. The immune system is what allows us to survive it
So
every
to
day.
fight off
Yeah, to fight off.
the
It's a
illness,
defense. Yeah.
defense mechanism,
Yes.
right?
So there's always pathogens around. So in the immune system, there's characteristically there's two big parts to the immune system. One is the innate immunity, and the other is the acquired immunity or adaptive immunity. So the innate immunity is what you're born with. It's inherited. It's very non-specific. So it's your skin, the tears, maybe a mucous membrane of your throat, of your gut. So these are the things. So it acts as a barrier. But when this fails, when this barrier is breached, and the bug enters the blood system also, then the second part kicks in, which is the acquired or adaptive immunity. That one is more specific. So it's got phagocytes, white blood cells. So that's they call it phagocytes, and lymphocytes.
I remember in school,
Yes.
the white blood cells, we knew it as the soldiers of the body. Is that right?
Absolutely, absolutely. So when you take a blood sample and you spin it down, so you have the red blood cell and a small layer at the top called the white blood cell. That's where all these cells are, the soldiers of the body. And there's two kinds. There's the phagocytes and there's the lymphocytes. And these ones here, when the innate immunity is breached and they enter the blood, these cells actually are the ones that engulf these bacteria when they find them in the blood and kill them.
Right.
So that's how they operate.
I see.
Yes.
And thank you, Dr. Kama. That's really interesting and it's good. Like, we should all know this. So we'll get back shortly in a while. I want to talk about how we can keep a really good immune system. But that will be coming up shortly on Speak Your Mind, Gold FM, only the classic hits. Speak Your Mind on Gold FM, only the classic hits. And I do hope you're enjoying the program. Thank you a lot for your sweet company. We've got from the Ministry of Health, Dr. Kama, based at the Tumi Hospital in Tamavua, and very interesting, Dr. Kama, as we were speaking about the immune system, because you said, I mean, if you think about it, the immune system, if it's healthy and really good, we could prevent a lot of diseases. So what is it that we should do to have and maintain a healthy immune system?
Yes, thank you, Louise. So what we have in the ministry is the wellness program as well, and I think the concepts from the wellness program is quite important here. With the wellness program, I think there's 7 domains that they look after. One of it is eat well. So you need a good balanced meal and a good diet in order for you to be able to develop these antibodies and the immune system in general. And also there's the other elements that are there, with regards to the psychological, mental, and physical, and all this. You need to move, you need to breathe well, and all this, and it will sustain a good immune system. But what happens with the immune system is there are times that it breaks down, and it's important to understand when that happens. And basically, that can happen if you don't have a good diet, so malnutrition. Also, if in overseas, if you're an alcoholic, maybe in Fiji as well, I'm not sure, but I don't have the stats for that. But surely it's happening here as well. Obesity is another thing that can
Trigger
that.
a bad immune system.
Yes. HIV,
Right.
and diabetes mellitus. So diabetes, and this can bring the immune system down.
Okay. So for a balanced diet, can you explain simply what your meal should look like? Maybe, just say lunch and dinner, or just a plate. How is it to look in order to get a balanced diet? Is that vegetables, fruit, everything included on one plate?
Yes, absolutely. So they tend to actually quantify the amount of carbohydrates that you need, the amount of protein, and the amount of fat and so on that you will need, with lots of vegetables and also fruits. So if we go through the specifics of it, probably take time. But then I think that's the whole in a meal.
Yes.
That's what you probably need.
And exercise as well, I believe.
Exercise, yes,
Yeah.
moving,
All goes
exercise,
hand in
it
hand.
all goes hand in hand.
That's right. So, yes, it's important to have a healthy diet. I mean, if you have a small background piece of earth, I'm sure you can plant some fresh vegetables and eat vegetables every day.
Yes.
Because I mean, I notice people are getting a lot more aware of how important our food is in to have good health and a good immune system. Thank you, Dr. Kama. Now, World Tuberculosis Day was observed on the 24th of March. That's not too long ago. Could you please tell us about World TB Day and why it's observed?
Yeah, so World TB Day is basically a commemoration of the tuberculosis control globally. So basically, I'm aware as well that it's also the day that tuberculosis was on the 24th of March. Is also the day that TB was also diagnosed or identified
Right.
by Robert Koch. So that's right way back in the 1880s.
Well, I mean, this guy is something to have discovered it. Don't
Yes.
you think? I mean, he's helped mankind.
Absolutely, he did. And so he won the Nobel Peace Prize for that. And he was a German scientist and physician as well.
Right.
Yes, but for in Fiji's case, I think we celebrated it, or not celebrated, we commemorated it on the 22nd, though formally with the Ministry of Health. We had the minister actually doing the honors. So the whole objective of it was to create awareness again, and ramp up, the activities as well with that activity on that day. Yeah, so it also set a platform for our program as well moving forward. So
Right. So, what did you have on the day?
yeah, so we had a launching with the minister, and then there was lots of other activities, competitions with the schools and in the schools and also the communities. So there were about 20 or 21 sites that actually observed World TB Day around the country.
Okay, that's good. All right, so that's what you did on the day. Now, in recent years, how many cases have been recorded of TB in Fiji? I mean, in roughly.
Okay, so from the National TB program of the Ministry of Health, I think it started in 1951. So 1951, from 1951, the data that has been analyzed from 1951 to 2010, over around 14,900 cases, I think, and that gives an average of about 230 or so cases a year from 1951 to
2010. Right.
Yes. So that was the scenario then. I would imagine that maybe in 1951 there were more cases, because there were definitely more cases before that, which is why the program actually started. Whether there was an outbreak then, however they defined why the program should have started at that time, we don't have records of that, unfortunately. So it should have been a huge number of cases at that point. And that was, I think, a spillover from the wartime and all that, globally and also in Fiji, because we were also involved in that at that time. Yeah, so from that period
to 2010,
from 2010 onwards, we had assistance for TB control from the Global Fund, and I think there were more laboratory tests and other diagnostic services that came in. So we were detecting from the last, from 2010 onwards, over 300 cases a year. And so the detection rate actually picked up then.
Yeah.
Yes.
300 cases a year from 2010.
Yes. So
That's quite a lot. I mean, you wouldn't think so, but yeah, we'll be back soon on Speak Your Mind with more on Gold FM. Speak Your Mind on Gold FM, only the classic hits. I'm Louise Kaunisella, and our guest is from the Ministry of Health, Dr. Kama, who is based at the Tubi Hospital in Tamavua. Now, we were speaking about the cases of tuberculosis that we've had in Fiji. You said from 1951 to 2010, it was 14,900. And then from 2010 onwards, 300 cases per year. And, I never realized that we had so many. So my question is, what about deaths?
Deaths. Okay, so the data that we have on deaths, and I emphasize this again, the data that I'm presenting here is data that have been published already on TB in Fiji. So with regards to death, I think the 2015 data that we have on TB in Fiji with in terms of death mortality is around 8 deaths per 100,000 people. So out of 100,000 people, 8 deaths in TB.
Okay, so why is it that they died? I mean, did they have the complicated cases of TB, or they didn't come early enough for a diagnosis?
Yes, usually it's late presentations for diagnosis. So when they come in, the disease is quite complicated at that point. So it's gone way beyond what we, the medical services, can do to save them. So in that case, there's the survival is very minimal.
Oh dear. So when they came in, like they'd been coughing blood or something, or because I heard they normally tuberculosis you cough blood. No, is that wrong?
Yes, they cough out blood and all that. But then if you have extrapulmonary TB, this is very difficult to treat. And if you have pulmonary TB itself, and you haven't come in for treatment, for say over a year or even 5 years, then your chances for surviving it is very small.
So in that little suspicion, it's better to be safe than sorry.
Yeah, absolutely. I think that's the way to go. If you leave it for too long, you don't know where your immune system is, the status of it, whether it is able to fight it or not.
Exactly.
So it's better to present, get the treatment done, so that your immune system can be assisted, to fight the disease.
So on that note, we haven't spoken about treatment yet. How is tuberculosis treated at the hospitals?
Yes, thank you, Louise. First of all, you have to get diagnosed.
Okay.
So you've got clinical symptoms, and then they will usually take a sputum, do a smear and in microscopy, or they do another more specific test like a gene expert test or culture, just to identify that it's the microbacterium
You've
that's
got.
causing
Yeah.
the disease. So
is it done
X-ray.
here? Is it all done here?
Yes, absolutely.
You don't have to
It's
send it
we don't
overseas
have
or
to
anything
send
at
that
all?
overseas,
That's
yes,
really
it's
good.
done here, yes.
Okay, sorry about that. Yeah, and then you said after
And
that.
there's also the X-ray, so that if you're not producing sputum that well or anything like that, even the X-ray is able to tell us if you've got TB or not. There's also the skin test. So that's typical in skin test that we can also do. It's called MEN2 as well. So that once you have a little bit of swelling after they inject the tuberculin in your skin, and it tends to swell, and then it's measured. And if it goes above a certain diameter, I think it's about 20 millimeters, then the suspicion is very high that you might have tuberculosis. So once that's done, and if you're diagnosed, then you're admitted for treatment. And usually the treatment, you're given at first, the intensive phase, you're given 4 drugs, and you complete that within 2 months.
Okay.
Yes. And then there's another 4 months of treatment with 2 drugs. So you need this combination in order for you to then, get rid of the bug completely.
So you can actually get rid of the bug
Yes,
completely.
you can
That's
get cured.
good news.
Yes,
Yeah,
you can get cured from the disease. Yes.
Excellent.
So one of the outcomes is cure, and if you comply and you adhere, throughout taking the drugs all throughout this period, then you'll be completely cured. So that's a positive thing,
Yes.
for this disease. Yes. compared to others.
Right. So, yeah. Okay, about the treatment again. So, I'm taking the most common one, antibiotics. You give them antibiotics?
Yes, absolutely. They're all antibiotics.
So,
So
different kinds of, because there's different kinds of antibiotics or different names.
yes,
So, which one do
absolutely.
you normally give?
Yeah, so
Amoxicillin?
not exactly. So these are
Okay.
specific drugs
Yeah, yeah.
that target.
Yeah.
So these drugs were developed and they are specific only to combat TB, and they can only destroy TB.
So,
So they're very
you don't
specific.
drink that for anything else
No, you
but.
can. Some of them you can,
Oh,
like
okay.
rifampicin. It can be also protective for other diseases, like
Oh.
meningococcal disease and all that. But the combination I'm talking about, the
Right.
combination of them, of the four, and or of the two,
Yeah.
is specific for TB because of the way the characteristic of this bug is. So it needs all four to be at least to be used over the first 2 months,
Right.
and then the two to continue for the next 4 months.
So, it's 6 months of treatment.
6 months
That's
of
how
treatment.
bad that bacteria is.
Well, yes, but initially it was almost 9 months. So, so with the improvement of drugs and all this, they've reduced the time period. So the drugs that are usually used, the antibiotics that are usually used, the rifampicin, you've got pyrazinamide, you've got ethambutol, and you've got streptomycin. Four drugs. And then when you do the 4 months, after the four, when you do the two, that's rifampicin and isoniazid. So that's yes.
Okay, so that is truly amazing that these days you can actually get rid of it. What about in the old days? I mean, there must have been lots of death.
Yes, we would assume that would be the case, because if you don't treat the disease, at least for 5 years, and it has an impact on the whole family. So that studies in England and also in Europe have shown this, so that when one of them has TB and is not treated, it spreads to the whole family and it shortens their lifespan. No, so we're talking in shortening the lifespan. We're talking about death at 40, death at 50. Not going beyond the 60 years mark.
Man,
That is concerning.
yeah, very concerning indeed. I mean, I feel for you being a doctor to be treating them as well. I mean, you could get it too, treating someone with TB. How do you protect yourself?
Yes, absolutely, and that's a very good question, Louise.
Yeah, honestly.
Yeah, so we've termed this kind of situation or condition within the hospital as nosocomial infections for healthcare workers. So basically, for any hospital, there's always an infection control policy and procedure that we need to follow. So it's for any disease. It's not just limited to TB or no specific disease. It's for any disease. But the question is good because because it's just if you zoom in on TB itself, how exactly how exactly can you protect yourself in a healthcare worker situation, not only for the healthcare worker but also for the patients that come to the hospital.
Exactly. I always thought that, I'm going to go to the health center. I'm going to take my family. I'm going to catch something there.
Yes,
that's
absolutely.
always the thought.
Yes.
Okay.
And it's very relevant, and it's a realistic question as well, and how you've put it is basically how we should be thinking about this as well.
We'll be back soon on Speak Your Mind with more on Gold FM. Speak Your Mind on Gold FM, only the classic hits. I hope you're enjoying the program and also learning a lot from our friend Dr. Kama from the Ministry of Health based at the Tumi Hospital in Tamavua. Now, you said I raised a relevant question about how doctors protect themselves from contracting sicknesses, any sicknesses as well. I mean, I thought, even TB, that's quite serious. And even for patients who are at health centers. So you can continue from where we left off, Dr. Kama.
Yes, thank you, Louis. So in hospitals, we would expect, that there would be a triage area within whichever health facility that you will go to, or whoever presents there. And in that triage area, maybe nurses will probably be able to identify someone that's coughing a lot and isolate them somehow in a place where they can see the doctor quickly, or something to that effect, but remove them from where the large numbers are actually waiting. So I think in that regard, that is probably, we term that an administrative control at the hospital level.
So everyone goes through this training. I mean, the nurses and
Yes, basically,
doctors,
yeah, the triage should be there.
Okay.
And for the doctors and nurses, especially in a treatment center for TB, when we just focus in on TB,
Right.
especially in a treatment center for TB, they're supposed to be wearing masks, usually either surgical masks or respirators. There's a very specific masks, especially if the risks are quite high. You have someone who has active TB around coughing in that kind of setting. But you wouldn't know that in a setting where there's general outpatient. So we encourage everyone to be actually practicing it with the healthcare workers. Do the administrative bit, triage them, look at someone that's coughing, isolate them, and even the doctors and the nurses are supposed to be washing their hands regularly, having practicing the infection control policy, wearing masks if need to, and so on and so forth.
Excellent. Thank you for letting us know about this, Dr. Kama. And which areas have recorded the most cases of TB? Are you aware, like in Fiji, are there certain areas where you have more people that got TB, or is it just scattered?
Thank you, Louis. So we have the data for that as well. Basically, I had mentioned, there's more than 300 cases that we see every year. What we've seen as well is that, that more than 300 or 400 cases that we see in a year, that amounts to about, in terms of incidence, that's around 49 per 100,000 cases that we see that are out there in terms of incidence. So basically, in terms of geography, where exactly they're occurring, at most. So basically along the Suva-Nosore corridor, that's where the highest numbers are.
Oh, dear. Any reason for that?
Basically, we relate it as well, associated with, the settlements. There's also poverty. There's also, there's also lots of immune-associated conditions, immunodeficiency-associated condition around these areas as well. So that's why the population is quite high. And TB is a population-based disease.
Okay.
So it's high here. And then there are other epicenters as well around the country. In the north, you also have some centers in the north and also in the west. So we've detected centers that we are focusing our resources on in terms of the control element.
When did Fiji first record TB in the country? Did you say it was in 1930s or something?
Yes,
1951. You said 1951 we've started.
We started the TB program. So basically it's probably well before that. It may be, if even our first contact with the outside world they would have started from there, which probably dates back to 1700s and 1600s.
Right. So was this bacteria already existing from when time began, or did someone bring it into? Did it just exist in the air everywhere around the world? Right.
Not exactly. No, it has to be with the person. The person then transmitted to another person through the air. The air is just the medium.
It's a medium.
The reservoir.
So,
the reservoir is the
I
person.
get it now. So the bacteria you can pick it up from anywhere, like the ground or the outside.
No, usually through air.
Oh, okay.
The transmission mode is usually through air. The droplet nuclei I mentioned, and also, in milk, the cow's milk.
Oh, right. So, yeah, that probably would be something to do with it. But I had a listener who called in and she had a question. She's from New Zealand. And she said that when she was 14 years old, they used to have prick tests where they had 6 tiny needles. And this is something like a vaccination. Do we have anything like that here?
Yeah, so I had mentioned something on the tuberculin skin test for diagnosing TB as well. So I think she probably is referring to that one.
I see.
So it's a very indirect method.
Oh, okay. And she said that some people actually were allergic.
Yes. So basically, it will form an allergy, and your skin will probably swell if you have, if you have TB. So you have some immunity to TB.
Okay.
So it'll pop up. So even if you've had a vaccination of TB, it will be positive as well. Yeah, so your body, the blood system in your body or your serum is basically just a huge library of everything that you've encountered, with bugs
Yes.
in this world. So you're able to pick that up, through tests. And you can, through tests you can pick that up. And also with TB, if you do a skin test, you can pick up whether you've encountered TB before or you're encountering TB now. But it's not very direct.
Yeah.
It's not a direct way of finding TB. If you take a sputum test, then you can see the bug and you can ensure that this is positive, that you got the disease.
I think that would be the best way. But hey, we've come to the end of our Radio Talkback show, Speak Your Mind. Many thanks to you, Dr. Kama, for talking to us about this illness, tuberculosis.
Thank you, Louise.
Vinaka, on Speak Your Mind. Until next week, many thanks also for your company. Nisamo Demanda.